Good morning, everybody. My name is Kim Poe. I'm the Children and Young Adult Consultant with the Connecticut State Library, here with my colleague Ashley Sklar, who's the Adult Services and Community Engagement Consultant. And we are here with the fifth of six workshop series that all center around trauma-informed services. This is a facet of the GELS initiative that was started by the Connecticut State Library. GELS stands for Growing Equitable Library Services. This is just one of a multitude of series that we have offered over the last, I'm just going to settle in and say 3 years. 3 feels good. So today we are going to hear about becoming and planning for trauma-informed services, a session that we're incredibly excited about. And again, I'm just going to quickly, I'm not even going to read the whole bio, but just quickly say that we're going to be presented to by Beatrice de la Espriella. One day I'm going to get it, who's a licensed clinical social worker who has just been with us going through every facet of being able to be more trauma informed in our library services on behalf of our patrons. But what we love to hear from Beatrice is that she is talking a lot about being trauma informed with regards to ourselves as individual workers, our fellow staff members. So I'm going to turn it on over.
Today was the day. You did say the last name perfectly, so yes. All right, well, thank you for that. My name again is Beatrice, and I am a licensed clinical social worker. I do own my private practice, and I provide services to individuals who may be experiencing anxiety, but also a history of trauma. I am an EMDR certified mental health therapist as well. So trauma, when it comes to trauma and anxiety, those are my two passions, and specifically becoming trauma informed and being able to provide those services from that trauma lens. So, all right, before we jump in, I do want to take a moment to be present. You know, mindfulness is actually one of my other domains and areas of specialty. So I am a huge proponent of making sure that we are in the moment, that we're here, ready to listen, ready to take care of ourselves. Some of you I know are working and it's going to be difficult to come in and out or to be 100% present here, and that's totally okay. But for this moment, just for one quick second, I would like for you to just go ahead and take a moment to breathe and be here with me. Let go of anything that maybe happened earlier this morning. Maybe there was somebody that cut you off in traffic. Or if you work from home, maybe there was a family member that wasn't in a good mood this morning. Let's go ahead and acknowledge those things that happened today, and let's go ahead and take a moment to just be here. So I'm going to stay quiet for a few seconds, and all I want you to do is just take a moment to breathe in and out. Take a moment to breathe in and out. Notice your thoughts. I don't want you to push them aside. I just want you to acknowledge them, acknowledge the feelings, notice what it's happening right here with you, and then be able to push aside that for a moment and just focus on your shoulders, focus on your body, focus on your breathing. Take a deep breath in and out. Take a breath in, out. Let's go ahead and do one last breath in and all right. Thank you for that. Thank you for those that were able to do that for me. Thank you. All right. My agenda for today, I am going to be talking a little bit about trauma, what trauma is, trauma-informed services. I will 100% recommend for you to go back. If you need additional explanation or additional details and things, that I may not be going over today, I know I went over it on our previous webinar. So I know Kim and Ashley are really good about posting those links with the previous trainings. So if you are new to our trainings, go ahead and take a look back, check those out really quick. It really goes deep into those trauma-informed services and what it means. And if you are been with us in the past, welcome back. So I'm excited to dive in. So again, we're going to talk about trauma-informed services, SAMHSA's, which is the Substance Abuse Mental Health Administration, that model of trauma-informed care, what that looks like. And then also I'm going to be sharing with you a trauma-informed services framework that I have developed. And then towards the end, we're going to do some takeaways and some Q&As. I will say, if you do have questions as we go through the presentation, because it is going to be a lot of information, please, please, please put it in the chat. I know Kim and Ashley are monitoring that. Every once in a while will be jumping in. So I do want to be able to clarify if there's a question as we go through the presentation. I don't like to wait to the end. If you think it's something that I'm going to cover, I might be able to cover it. But if it may not, I still want you to go ahead and write it in the chat so we can talk about that. And I know Kim and Ashley will just kind of wave and give me a heads up and let me know so I could take a pause. All right, so here is my definition of trauma, the one that I like to use, which is from the Substance Use and Mental Health Services Administration. And it defines trauma as an event and series of events or sets of circumstances that are experienced by an individual. And it could be either physically or emotionally harmful to that individual. It could be even life-threatening. But the key part about this definition for me is that these events have a last adverse effect on the individual, on that person's functioning, the way mentally it impacts them. It could be even physically, socially, emotionally, or also it can impact their spiritual well-being. So, what are some examples of trauma? I know we talked a little bit about it, and I have it in here. So I don't want to go too much into it, but here are some examples of trauma: adult trauma, and things that happen in our adult life, trauma of poverty, historical and cultural trauma, arrest or incarceration of self of a loved one, physical, emotional, sexual abuse, substance abuse could definitely be an example of trauma. The individual starts with the substance use, and if they are later, let's say they recover, and then they later found themselves closer to an environment that is similar, it may be traumatic for them to remember the past and some of the experiences that they went through. Domestic violence, hospitalization, suicide, sometimes even divorce. Not every individual who experiences trauma feels it the same way, but there are some times that could happen. Same also with like a deportation of a loved one. Here are some effects of trauma and how much it impacts the individual. So it could definitely impact memory, it can impact concentration, it can impact the way we learn in our relationships with others, it can impact how much we are able to focus and be present with our relationships and our significant others. But then trauma has also been related or linked to chronic health problems. So that's heart disease, obesity, diabetes, addiction, cancer, autoimmune disorders. So individuals who in the past, when they were younger, growing up, experienced some very difficult traumatic effects or traumatic experiences later in life, the study found that they could be linked to chronic health problems. I don't know if any of you, whenever you have a very high stressful situation, first thing that happens is your stomach kind of gets all jumbled up, those butterflies and things like that. So having those constant exposure to trauma when you're growing up could also lead some digestive and gastro issues. Right. So what is a trauma-informed care, or what are trauma-informed services? I use the word care and services in interchangeably. So care, if you look at it, it's more for that residential facilities, medical providers, doctors' offices, therapists. That would be a form of care. But when we're talking about services, is when you have a service to the community, so schools, libraries, facilities that don't necessarily have a one-on-one relationship with that individual, but they still provide a service to them. A trauma-informed service incorporates the knowledge about trauma, so knowing how prevalent and pervasive and trauma can be into the services that we provide to the individual. And the key of them is making sure that we're not re-traumatizing that person. And we'll go into the model just for a second, but the one thing that I want you to take away from understanding what a trauma-informed service is or trauma-informed care is shifting that focus of what is wrong with you to what happened to you. So when you have individuals that are behaving erratically in situations that it's hard to understand what's going on with that person, instead of asking, what is wrong with you? We're looking more like, what happened to you? We're coming from a place of curiosity. And that's one of the things I want you to take away when we talk about trauma-informed services. So here is Samsha's model of trauma-informed care. And they use the three E's, which is the event, experience, and effect. As earlier, I don't know if you remember with that definition of trauma, we looked at event, the experience, and effect. When a person is exposed to a traumatic or stressful event, how they experience it greatly influences the long-lasting adverse effects of carrying the weight of that trauma. And then the model of trauma-informed care goes into what they call the three R's: realize, recognize, respond, and resist re-traumatization. So individuals and agencies that want to have this trauma-informed services need to have the understanding of these four R's. So a program, an organization, or any kind of system that is trauma-informed realizes the widespread impact of trauma, recognizes the signs and symptoms of trauma in the individuals that they serve, responds to that by fully integrating that knowledge into their practices, into their policy, into the procedures that they might have. But then it also seeks to actively avoid re-traumatizing the individual. And the last part of the trauma-informed care model is these 6 key principles, which I know there's a webinar on each one of all of these. So I would definitely recommend you go back and take a look at those. But we have safety, trustworthiness, and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and then our cultural, historical, and gender relevant situations. All right. So what now? Any questions? Let me just make sure. Yep, perfect. Yes, the slides will be provided as well. So what now? We want to be trauma informed. We want to implement these services into the library. So the webinar for today is, what do I do? How do we move forward, right? So this right here is an overview, excuse me, of the framework that I've created to become trauma informed. And I kind of debated to call these steps or sections or domains, but I didn't want you to think that this is a linear process. This is a step-by-step process, because we're always going to be assessing. We're always going to be looking at those setbacks and roadblocks and situations. We may not always be redoing a committee, right? But individuals may fall off of the committee. So we may have to, in the middle of implementing something, reassess and create a brand new committee. So, and our action plan might change based on our assessment. So I wanted to make sure that you had a quick overview of what are some of the things to look into, but we're always assessing, we're always moving these pieces front, back, and forward. All right, so the first thing I want you to kind of go over, and one of the things that I see most with regards to implementing change, a library says, hey, I am ready to move forward and take action, or not just a library, but any facility. I'm ready to move forward. I'm ready to take action. We're going to be trauma informed. We're so excited about implementing things and we're ready to go, but we jump a very important and key aspect of our implementation process, and that is taking an assessment. So as a social worker, assessment is like a number one thing. We really want to know, is your library ready for change? Is the staff and organization receptive to that change? What is the culture of your library, right? We want to learn and find out, is, is your library, like, how resilient is your library to change, or your staff to change? If you try to make changes in the past, what did you learn from it? Right? So in this stage, in this section of it, before we jump in, before we do anything, we have to take an assessment, right? And he want leadership and management to be assessing and providing all the answers. This is actually an opportunity for library staff of all levels to speak up, of all levels, to learn more about what's going on. What do they think? right? This is the section that it's more an exploration. We're exploring, we're looking to see what are some of the changes that we need to do, but we're not thinking about the changes. We're just asking questions, we're gathering information, right? We're looking at what's needed and then preparing for that change. Now, because assessment is a big part of implementing a trauma-informed approach to services, I wanted to provide you with a few samples of some assessments you could use. You don't have to use one or all of them. You don't have to, I'm going to say which one I like most, but your library may not fit into that category of that assessment. You may even want to create your own assessment based on gathering all of these informations. So here is a quick sample self-assessment that Rebecca Tolley created. And she has this book, A Trauma-Informed Approach to Library Services. If you really like this, I would definitely look into that. It's a really good book. But her questions have, is the need of trauma-informed care in the organization clearly defined? So you want to look, you may want to be trauma-informed in your library, but is there a need for that? Is this something that this model, is it appropriate to be able to make those changes in the library? This question is, for me, the most important. Is the timing right for this initiative? This is the time when you make that question and you talk to your staff. Are there other things that are happening? I do know there's a library that I'm working with that they were doing an expansion. So they're not ready to implement any changes if they're focusing on expansion of their library, right? And then the other question that I think is super valuable is, will the library provide library workers with adequate time and resources to support active project participation? I think that's very, very important. Instead of just saying, here, this training, get trauma informed, and then that's it, we're done. It's, are we going to give them time to train to receive those resources, but also support them in implementing some of the changes that we want to make. The key in the stage is not to incorporate any level of change. So we're not making any change. That's definitely something that could backfire. The first part is to make sure there's a focus on raising the readiness of your library. So if you notice that you answer no to some of these questions, maybe it's important to just kind of understand before we jump into implementation, we might look into, hey, how maybe let's do a training on resiliency. Maybe let's do a training on change. Let's go ahead and take the temperature on change that our life with. Another question that's very important, I think is super super vital and important. Will the library allow time to prepare and constantly work on trauma-informed principles? So once again, we're looking at, are we just dumping additional tasks on the staff to be able to get done, or are we allowing them, maybe rotating some of the task among individuals so they have time to learn some of these practices, to learn some of the things that that they need to make? Will the library reinforce and reward positive behaviors and improvements within the trauma-informed framework? Is this something that is the library able to do? When we notice a staff member having a very good conversation with the patron, being able to help them regulate the emotions, right? Maybe your staff member gets to see that and that it's dysregulated, and then go in and support them from a trauma-informed lens. How are you going to reward that behavior? Are you going to acknowledge them publicly? What is the plan? What is usually your library do? Is your library one that's like, yeah, that was a good job, and then move on? Or are you planning to do something a little bit more? And is your system set up for that? Right? So just one thing, it's not just about answering these questions, but how will that come next? So like, how would you, and here it's like, will the library reinforce and reward positive behaviors and improvements? Like, how are we going to do that? How can we do that? We're not doing the implementation piece, yes, but yes, we're willing to do that. And here's some brainstorming that we could do. And that's part of our assessment. All right, so let's see. All right. So here's another example that I think it's very important. So In therapy, some of us use motivational interviewing to assess an individual's readiness for change. Now, there are 5 stages of change within that motivational interviewing in order for individuals to kind of adopt that healthy behavior, or maybe just stop an unhealthy one. So the stages of motivational interviewing are pre-contemplation, contemplation, preparation, action, and maintenance. Now, there's a similar approach that can be utilized for organizations. The trauma-informed organizational capacity scale, and this was created by the American Institute of Research, can help you assess your library's readiness. It can help you answer the questions, how trauma-informed is your library? I don't want to go too much into detail with each of the assessments that I'm going to provide because I just wanted to introduce them to you and see that there are resources out there that you can utilize to make these changes and to create this assessment. I liked this one particularly because it helps you determine a baseline for the organization, specifically to find out how much training it's needed within the agency. It could also give you some strategic planning on the professional development as well, and then also get an idea in assessing what areas need improvement. Now, just remember, each organization is unique. So please make sure that you review all of these assessments and just kind of pick the one that is works best for your library. Any questions so far? Let me see. Oh, great. You could borrow, yes, thank you. Thank you for that. You could borrow that book there. All right. Oop, I don't know why. Now, while this assessment is focused on services that libraries may not provide specifically, so like, for example, treatment and planning, or doing some specific care, I think it could definitely be used to measure where the organization it's at. So it can bring light into what needs to be addressed within the organization. I think there's great benefit in seeing where the organization is at and how they can better serve children and families who may have experienced trauma, but also work in supporting the staff that works directly with those children and families. So if you do a lot of programming and you notice that your library is one that their children's section is super vibrant and it's definitely very well received by the community, this might be one that I think would be important. So I'm a firm believer that all individuals and organizations have strengths and that these need to be highlighted when we're completing these assessments. So that's one of the main reasons why I like this one. It was created that the trauma-informed organizational assessment was created by the National Child Traumatic Stress Network. But I just love how this one has this highlighting the strengths about the organization. And I think that's super powerful because you can learn from what's working in one department and be able to replicate it into other ones. I just want you to know, like, assessment is not just about negative stuff, or only about the areas that we need to improve, but also about highlighting the areas that are strong and just being able to learn from that. Another part right here, and one of the domains that I like, is addressing, minimizing, and treating secondary traumatic stress. Some libraries do have a lot of patrons who come in and share a lot of their experiences, and that could definitely lead into secondary traumatic stress. So being able to learn that assessment and in that assessment to see how are you supporting your library staff in that. I am going to be talking later about a pilot program that I'm going to be launching pretty soon, and I'm interested to see if any libraries are interested in just learning more about it, but I'll talk a little bit more about that later. Here's another assessment that was adopted from the National Center on Family Homelessness, Trauma-Informed Organizational Self-Assessment. And this assessment is intended for programs to assess their own practices on trauma-informed services. And I think it would be important to use at the beginning. I like this one a lot. Supporting staff development. It just kind of gets you an idea of like where you're at and gets you understanding some patterns to see historically done and how can we make a difference. So I think that's important. Noticing those patterns, it's vital. Jeez, that is not my word of the day. Noticing those patterns can definitely give you an idea and focusing on what you need to change. Because if we continue to stay within that pattern, within that cycle, and nothing's changing, we may want to do something about that. Again, I think it would be important for all of these assessments, just go ahead and take a look at them, take and choose what you think works for you, or just start with one and then just see how it goes. There is nothing better than an individual self-assessment. I also want to give an opportunity to make sure that you create or find an assessment based on our own beliefs, our own history, our own biases. So let's take a moment, like in when we do so, we're doing this organizational assessment. We're looking at the agency's culture. That's amazing. That's wonderful. But each one of us are unique. So we also want to management get an idea of what are your biases? What is the maybe some misconceptions you have about trauma? So being able to get that it's vital. I got that one. It's super important. Knowing your own story, getting a moment to learn your own story and see how your story can affect your behavior and the behavior that, your connection with others. So management does it, but I think each one of us individually should also do that kind of assessment. I unfortunately don't have a list of specific self-assessments that you can use, but I think they're very self-explanatory. It's just a matter of self-reflection. I think this is very easy to follow and easy to take a look at. All right, any questions about the assessment? Just want to make sure if there's any questions about any of the assessments. Maybe there's any struggles that you have within your own library that you notice that you're thinking about.
Actually, can I ask a question, Beatrice?
Yeah, please.
I'm curious with the assessments, are those things that are available online? Is there a cost associated with any of those organizational assessments? I guess any more
Question.
information you could share. Thanks.
Yeah. So some of them are available, readily available. One of them, and I can go back into my notes, but I think one of them is available. It says on the website that it's free, but you have to like register to be able to get it. There are other ones that are you can just Google them and find them, and then others you have to pay for. So I think each one of them individually, it might be a different. So just type in, and I think in my resources, I have the links to them. So I would go ahead and look in when you get to the slides, go all the way to the end. There is the list of resources, and you're going to have links to those. But then you're going to have to go into each website and get some of that because some of them do have them for free, but others you do have to pay for. So good question, Ashley.
That's great. Thank you. Thanks.
Yeah, of course. Yeah, and if you ever run into any issues with, like, for example, the self-assessment, I mean, I could take so much time creating one, and like talking about it because I love them so much. But I think they're valuable doing self-assessment and self-reflection. I think it's important. But if you run into any issues, my contact information is also at the end of the slide. So you can always email me and say, hey, I can't find this. Is there any way you can help me out? Or do you think this will be better than the other? I would love to be able to support all of you. So yeah. All right, so let's go ahead and jump into section 2, setbacks and roadblocks. The goal of this section is to identify and address the potential setbacks and roadblocks that you or your library might encounter when implementing trauma-informed services. We first want to identify what these might be, and then we want to figure out a way to address them. So the part 1 is identifying, and then part 2 is addressing them. And addressing them, maybe right away it's not possible, that's okay, but at least being aware of what those roadblocks and setbacks might be. So it's acknowledging them, keeping them as part of your implementation process. So when you get to the implementation, you have an idea of like, hey, this is something we identified as a potential roadblock. This is one of the things we thought we might be able to address it. Can we, or to address it, can we not do that? So here's a way that you can take a look at those setbacks and roadblocks. You want to review policies for any barriers. Is there anything in your policy that's going to stop you from implementing that trauma-informed practices? What might be some visible barriers, but what might be some non-visible barriers? So for some visible barriers, the lack of training and education, that might be something you immediately know. It's like, hey, only 3 of our 20 staff members are trained on trauma-informed services. We need to be able to train more individuals. Maybe there's some limited resources and funding. Or another visible barrier could be a stigma or misunderstanding of what trauma is. A lot of it, it's easier for us to believe that, oh, that person is just crazy. Ooh, wrong word to choose. Let's go ahead and train some individuals on what is the best way to be able to identify an individual's mental health concern and be able to use the right words when it comes to that. And then some non-visible barriers, unrecognized trauma in the community. What is the community saying? Are you listening to some of the things that the community is talking about? What is the culture within the organization? Is it supportive of trauma-informed services or is it not? And is there implicit bias? So in here, we want to kind of predict what might be the reactions and the resistance from either staff or stakeholders. Can you do that? Can you take a moment to sit and say, hey, is there something that we could do about this? What is something that we might find as a roadblock as we move forward? So we talked a little bit about this, but then one of the things is in here that I wanted to highlight is that staff burnout and that secondary trauma, I think it might be a setback and a roadblock. So how are you going to address that, right? So every library is different, right? Every library knows best, what are some of the roadblocks that they have. Are you going to have challenges in creating a culture of self-care and compassion among library staff, you know, or even though there's, high workloads and emotional demands, how are you going to foster that culture of you need to take care of yourself? You need to fill your cup before you can be able to serve others, before you can talk to others. It's your library. If that is a roadblock, how are you planning to address that? Okay. All right. So you assess your library. You identify which areas need support. You know which areas you're really good at, which departments may not be ready for change. Maybe some additional training needs to happen. Which areas are doing an excellent job and ready, and you're going to expand services. You have figured out any potential setbacks. You have an idea of how you're going to address those roadblocks. You're ready for change to take place. You're committed to trauma-informed change. You're committed to trauma-informed services. What now? What happens next? This is when we get to the planning stages of the trauma-informed services, of becoming trauma-informed. And the first thing is establishing a committee. Why would we want to create a committee? I want to open it up to anyone out there. Go ahead and see if you can type in the chat really quick. Why would we want to create a committee? Let's see. To hear a variety of experiences, more input from more sources. Absolutely. So establishing a committee, we got one more. Better chance of success. I like that. Thank you, Chris. Thank you. To offer support to others. Yes, thank you. So when we establish a committee, we have the opportunity to hear from multiple individuals who may be directly experiencing what we're trying to implement. We just don't want individuals who are just management. We want everyone, right? So who should be in this committee. We want individuals that are going to be able to support the change that we're trying to make. So we got key library staff. We have maybe patrons you want to include as part of this committee. What are some stakeholders? Maybe some trauma survivors. Why not? We're implementing a trauma-informed service. Why not include an individual who understands what you're trying to do? Get an idea of it. Maybe some local community agencies. Is there a mental health agency that could be an individual from that agency that could be part of your committee? Is there anyone else that we can think of? So I have a few here, but anyone else that you can think is specifically, if you can type it in the chat, who else do you think could be part of this committee you create? I can think of one. Let's see. Social workers, library board member. Yes, I like that. They get to see what's happening, right? They get to get an idea of here some of the things and the feedback that's going on. What about teenagers? Are you doing programming that could impact a teen? What about, LGBTQ individuals? I think it all depends on who your library serves, who's in your community. So if your community is represented or your library preserves a large group of teens, and that's who you see walking into your doors, those are the individuals that you want to be part of your community. Right? So what is the purpose of the committee? We want to determine, get an idea of how often we meet, when would they be meeting next, create a vision, mission, value statements, reviewing it. They get to help set up timelines for what's going to happen in an implementation. They get to oversee the implementation. When you develop a committee, you don't just have one individual that's responsible for that because that's way too much work. But you have a group of people that can make a decision and oversee the implementation process. They're constantly reviewing, constantly updating, right? So we also want to get an idea within that committee. You can have assigned roles if you want to, but just being able to decide like who's going to be there, how often. And then the purpose again is just overseeing that implementation so that we know and we get an idea of what needs to happen. So it's not just up to management itself to make those decisions, but the community in general, you have more individuals speaking up about that. With section 4, this is when we start creating the action plan. So we have our committee set. We have our assessment, right? It's the first step. We have our assessment. We understand some setbacks and roadblocks, and we have some idea of how we're going to address them. But here, this is where we get into the nitty-gritty kind of stuff. We create a timeline where we decide, okay, this is how much time we're going to use to plan ahead. This is how much time we're going to use to train individuals. This is how much time we're going to take to implement some of these things. And this is how much time we're going to take for evaluation and making changes. Your action plan is that roadmap that's going to lead to change. But the key I want you to keep in mind is that roadmap and that plan that you're developing should follow these 6 guiding principles. So that's why I keep referring back to the guiding principles of safety, trustworthiness, peer support, collaboration, empowerment, cultural and historical gender issues, because that is going to be what you use to make the changes, to make the steps necessary moving forward. So within section 4 of this creation of a plan, we have a few parts, but the first one is we want to create some goals. And I know we all talk about goals, and goals are great and they're wonderful. And we always talk about SMART goals, and I love them and hate them at the same. I just have this love-hate relationship with them. Because, are we being too specific? How can we measure it? Can we achieve this? Is it realistic? And is it within, do we have a time frame to be able to do that? But the key, it's what's going to help you create these goals, that assessment that we did right at the beginning. We want to look at that assessment. That's going to give you an idea of what are the goals instead of just sitting and saying, well, we're just going to train individuals. Let's be very specific in how we're going to do that. I do recommend that we have one goal per area and for you not to overdo and have way too many goals. So when you look at your assessment and you say, well, in this area or in this department, we're going to create this one big goal and this is what we're going to target. We can create additional goals later, but I think it's very important that we have, if you want to do more than one, that's great, but maybe just 2, 3, no more than 3 goals per area, because that would be way too much for us to do. I'd rather you do one, achieve it, and then add another one and create another one. Because there is a feeling of, there's a momentum, there's a thing, you just feel so excited when you cross off something from that to-do list. Same thing here. Create that one goal, achieve it, so then you feel super excited and ready to go and move on to the next step. So in here, we want to ask, what are the goals for the agency? What are we working towards? What are the steps necessary to get to that goal? And how are we going to measure our success? So here is a quick example of what a goal looks like. Total 5 staff members will be trained during the month of January 2023. This clearly, would be January 2025. Woo! Okay, that felt 2025. All right, is this goal? Yeah, so we can go even further to specify which department, but we also want to make sure that our goal is achievable. So I would say leaving it, 5 members, 15 members, whatever it might be, right? So we want to be able to get an idea on that. Is this goal measurable? We can measure to see if 5 staff members were trained or not. We can even, like I said, measure it even further using, how do we want to measure it? Are they going to sign up every time? How do we know that these 5 members were the ones that got trained? So is the committee going to be able to, how do they know? Is there a time frame for them to report who got trained and who didn't? Is this goal achievable? I think it sounds a very achievable goal, but again, it all depends on your library. Maybe there's a small rural library and there's only 5 staff members. Are you being able to do that? Or is this a pretty public large library in downtown that you have 20 plus staff? Are you able to do that? So just achievable definitely comes down to what your library is and just kind of tailor it based on your library's need. Is it realistic? I think it's realistic, but it all depends on your library. And is it timely? We have a time frame. So in this situation, we want to be able to adjust it so that we have, a specific time, or not adjust it, but just make sure that all your goals have a time frame for that. I think we have, all right, so let's see. And then the second part is the training goal. So we have this section right here of really quick so you see. So when we're in section 4, we're creating the action plan. Part 1 is that planning of creating the goals, and then part 2 is that training piece. This phase of the plan, should have its own little goals. What is it that you're hoping to do? How will the training take place? Is it something that's going to be self-paced, or are you going to do it on in-service day when everybody gets trained? Are you reaching out to an outside agency to be able to do that training? Are you partnering with a local agency to do that? So once again, just getting an idea of what the training looks like within that stage of your goals and creating that plan. What does that look like? So the plan is this, these are the areas. And once again, the plan is directed by that assessment. That's one of the things that I think is so valuable, that we find that and we assess what's needed and how are we going to do that. All right, before I move on, just any questions before I jump into the part 3? So part 3 is the implementation piece. And once again, we're looking at the 6 guiding principles, and this is also for staff and patrons. And what I mean by that is, if we're going to look at safety, I want you to get an idea of also safety for your staff and how does that look like. You know, here again, the assessment will dictate for us how are we going to implement it? Are there areas that we need improvement? You know, we want to keep staff in mind. Once again, I just want to highlight that it's very important, and go back to the idea of if we're addressing safety, if we're addressing trustworthiness, if we're addressing collaboration, that we also keep staff in the back of our minds when we're creating this. All right. So in the last thing we have is evaluation. How would you evaluate the effectiveness of implementing your trauma-informed services? And here is we need to define how we're going to do it. What are some of the things how are we going to gather even that information? How do we know that it's working? So is the goal, let's say, to train and, you know, those 5 individuals, is that our goal? Is that an effectiveness is that a milestone? Or is our milestone a little bit higher? How do we evaluate? When do we decide to evaluate? Do we evaluate in the next 6 months? Do we evaluate every month to see if we are implementing and making the changes that we decided that we wanted to do? You know, how much time do we want to collect the data and then to be able to make an informed decision? You know, do we need to change? Do we need to make some changes about how we are talking to staff, you know, things like that. So we're always learning, we're always adapting, and we're always adjusting. In this evaluation, that's why I said earlier within the framework, I thought it was very important that I highlighted that it's not a step-by-step process, but we're always looking at evaluating, we're always assessing, we're always taking an idea of what it's going on. All right. So within the evaluation stage, it's important to set up a system where staff can share what's working and what is not working. So it can help with the employee engagement, it provides the staff with a voice, it increases the staff morale, and you know that collaboration of staff can definitely make improvements in the areas that's make some changes in where it's needed. So ongoing feedback, it's super, super beneficial. And I think it's that this idea of a top-down approach where the administration provides positive feedback as well in areas of improvements to staff, that is very important too. So it's not just, okay, staff is saying what's going on, but then if management notices that there is good things that are happening in this evaluation phase, being able to say those things and being able to with individuals. And this approach, I feel like opens the dialogue, you know, opens an opportunity to talk about what's needed, to talk about everything that is going on with the individuals. All right, any questions about these so far? All right. Self-care. So we just wrapped up the framework in itself, but there is a part in the framework that talks about supporting the emotional well-being of staff. The reason I mentioned self-care is because when we're working towards creating an environment that involves talking about trauma and becoming aware of how extensive and problematic trauma can be, we can touch on some deep issues and wounds that some of our staff may not be ready to handle. They may not want to, maybe because of personal reasons, maybe because they don't, you know, they've been getting all this information from others. You know, maybe it just is impacting them in general. This is why I bring up, and I think self-care and highlighting that emotional resilience is super valuable. It is always important to take steps necessary to make sure that we're focusing on our staff's well-being. Um, Especially when we look at those assessments, there's always that staff piece, and I highlight it so, so much. But I also think that self-care is something that needs to be implemented in those planning stages. So we're in that implementation process and we're creating our goals and we're creating that plan. Is self-care part of that plan? Is that something that your staff, you want to support your staff with? Not only should you be aware of potential impacts, but then, you know, making sure that you create an action plan, right? So so that you can offer individuals an opportunity to process those emotions. You know, it could be partnering up with a local agency, or it could be something as simple as understanding this is an area for staff to be able to decompress when they've had a difficult conversation with a patron or whatever it might be, right? This may be an area for just a few minutes for them to meditate and be able to do some deep breathing, just like we did at the beginning, just taking a moment to breathe before you get back on the floor. You know, your organization, I feel like, can even take it a step further and provide self-assessments to the staff so that there is a culture of taking care of ourselves. So in that part of that individual assessment that I talked earlier, it's more about those biases towards trauma. But this assessment that I'm talking about specifically is your staff taking the breaks that they're supposed to? Is type of self-care? So let me ask all of you right now, go ahead and type in the chat, what is your self-care? What is your form of self-care? So as an administrator, as an individual that is higher up, I want to know, what does my staff do when they are in a difficult situation? So go ahead and put it in the chat really quick. Just curious, what is your form of self-care? Go for a walk. Thank you. I like that. That's usually what going for a walk, going outside. I always tell my clients, take a pause, take a moment, and being out in nature is so vital. There's something about that recharges us and it gets us going. Talking to a colleague, yes, definitely having a conversation to someone else, taking a step back, deep breathing, taking a step back, it's so vital. And so a lot of people, you know, we do it, but we don't take advantage of it as much. Take a walk around the building. If I'm stressed, as a company, you also have a Zen room. Yes, that is a quiet room with a nice comfy chair, TV, white noise, and whatever we need. Oh, I hope you have like coloring pages, coloring books, because that would be my kind of Zen room. That's what I do. I take a moment to write. If I have a lot of time, I'll write even further, but just a moment to put some color on paper, write a few words. That's my self-care. Walking, it's super, super powerful. Going out to the park with my son, whatever I need in that moment. But that self-assessment is understanding is your staff taking care of themselves? What are they doing to take care of themselves? And how can you support them? So what I was going to mention earlier is I am looking for 5 libraries in the United States. I currently have 1 library signed up, but I haven't opened it up to many libraries yet. So I wanted to share to all of you, I'm looking to create a pilot program where we develop some type of, I don't like using the word protocol, and I know I talked to Ashley about this, but some type of steps and process to support your staff. What is it that your staff has in place whenever you're having a difficult conversation with the patron? Are you just expected to just go back to work like nothing happened? Can you process? How can you process? Can your library support you in that? So if you are interested in learning even more about this pilot program, there's no cost to the libraries that participate. My goal is to just gather some information, implement these programs, and then be able to say what's working, what's not working, so that we can use case studies so that it could be replicated in other libraries as well. So if you're interested, you have my email at the end. Framework, yes, thank you, Ashley. That's the word. So developing a framework for allowing a staff or supporting staff when they have had a difficult encounter with someone or traumatic, you know, just maybe that so just that information will be, you know, there. Do you have an informational email about the pilot program? So if you are interested, you can email me and I'll just type it in here. Just say, hey, I'm interested about the framework to support staff. Let's just say that. And then you can just email me there and then I'll be able to send you some information with regards to that. But the idea, it's again, 5 libraries throughout the United States. I will talk to, you know, decide which ones I can support. And it's all about implementing that framework for supporting staff in when they have had a difficult conversation or difficult situation at we process that. Okay, so enough of that. All right. Any questions about this particular framework, the trauma-informed framework, or any questions about anything else? Right. So here are my takeaways. Here are some of the things that I just kind of want you to keep in mind and be able to, if you got anything from this presentation, this is a slide that you want. We're always assessing for need. We're always assessing. We're always checking in. What is it that our library needs? Assessment before implementation. We want to be able to take an assessment, learn what's going on before we decide to just all of a sudden, we're going to go ahead and train everybody. And then the assessment of the agency plus the individuals, it's super vital and important. We don't want to just assess the agency or the library. We also want to do an assessment on the individuals about their own biases, their own stories, their own misconceptions with regards to trauma. And then here's who are you inviting to sit at the table? And are you sitting at the table where decisions are being made? So this goes back to that committee conversation. Who are you inviting? So think about those individuals that you want to sit with you, those individuals that you want to participate in making these decisions. And are you being part of making, a decision making? Now, I get it. We can't invite everybody. We can't have every single library staff participate in a committee because then it wouldn't be a committee. But who is the person that can speak on behalf of the library staff? Maybe there's one individual that can do that. And that is how you have that representation. And implementation is different for each library. Each library has goals that are totally different. So want to be able to highlight it and understand that what works for one library may not work for another one, and being able to get that in the back of our heads. It's super, super vital. And then the last thing is do not forget self-care. I think it's super important. Maybe because I'm a mental health therapist, but the biggest thing is acknowledging that sometimes we're not okay, and that's fine. And being able to acknowledge that those difficult emotions are happening, and how can we then support ourselves and be able to be there for others. There's a huge saying, and I'm sure you've seen it in social media, you can't pour from an empty cup. So if your cup is empty, you need to ask yourself, like, what is it that you need to do to be able to do that? I recently did an interview with a therapist, and we talked all about self-care. And maybe I'll send you Ashley the link to that interview. And in that interview, she gives very concrete steps and tips on self-care. So Ashley, I'll send you that link for everybody to have. But it was so vital in what she was saying, and how important it is that we sometimes want to practice self-care, but we don't even know what we need or where to start. And that sometimes you're just like, yeah, I want to do self-care. And if doing your nails is self-care, but is that doing your nails included self-care, or are you trying to avoid emotions and avoid things that are happening in your life, and covering it as self-care? So I'll send you, Ashley, the link to that interview. I think it goes live tomorrow. It's a blog, and you can get more information, details on how to practice self-care. So yeah, and you can definitely add it to that page. So, all right. Any questions that anyone may have? This is questions about everything. Again, here's my email if you want to reach out to me. But any questions, I'm opening it to everyone. Must have done a good job. And I know all of these are recorded, so you can always, reach out, go back to the previous ones, and learn more about some of the things. I also know that because they are recorded, you may not feel comfortable asking the questions with specifically to your library. So please do not hesitate to email me directly. It's all confidential, so I wouldn't share anything with anyone. But if you do have questions and want support for your library and you don't want them to be publicized, I completely understand. You can definitely reach out to me.
Excuse me, Beatrice, I have, I think, one question, and I want to make sure I'm remembering correctly, but in the sort of sections that you outlined for us, I know self-care was not included in those, but am I right? But that was sort of your,
So
like,
this one?
yes. Or I guess, so would you,
Yes.
is self-care sort of
emotional support.
embedded in, okay.
Yes.
Okay.
Yes.
I was going to ask, seeing as it feels like a very important piece to this, you know, why was it not included in that section? But I apologize and stand corrected that it's part of staff emotional support. That makes sense.
Yeah, no, and I should have labeled it that instead of self-care. No, that's yeah. So within section 4, the action plan has multiple parts to it, and then section 5 is that staff emotional support. What are you doing emotionally to support them? And that's part of that self-care action of it. And it goes back to that assessment. It's asking the staff, like, what are you doing individually and how can I support you? So if your library does not have some level of staff emotional support or support, like the library that has that Zen room, that is staff emotional support. You know, you're definitely supporting your library, your staff, library staff in that. So, yep, yep,
Thank you.
no worries.
Yes, thank you. And I know I put it in the chat, but for anyone who's still here, I put in a copy of our survey, which many of you are probably familiar with, but we really do go through it and it helps us help you essentially. So like Beatrice said, a lot of things were covered in our previous four workshops, and we have our next one coming up is on navigating trauma insights for LGBTQ plus community, children, and immigrant population. So if anyone's ever wondered why we haven't done deep dives into different marginalized groups, it's because it's its own session, and it probably needs to be. But let us know how you felt about this session, previous sessions, now that you know what our next session is on, if there are things that you're hoping to learn about. If you let us know that, we can and will communicate with Beatrice just so she's prepared. Again, like these surveys help us help you. Like it's not just because we want them. It's just so you know, some of that groundwork that Beatrice was mentioning earlier, so that we can find the best way to support our patrons in our community. And just up here at this like weird state level, our community, our public libraries, librarians, and everyone who works in them. So thank you, everybody. We read them and they're anonymous. By we read them, I read them and they're anonymous.
That's important. That means that they're listening to you. They're, you know, they are listening to what you're saying. So if there is something that you want, you should definitely say it, because sometimes we think that someone else is going to say it, but they might not. So definitely speak up.
All right. Thank you, everyone. Have a great rest of your week, day, all of it.